So thank you and good morning, everyone. And it's my pleasure to kick off this panel presentation on pedestrian safety. And my job here today is to put injuries into perspective as a public health problem and present some high-level statistics on Canadian motor vehicle traffic-related injuries and fatalities to road users, including among pedestrians. So, some of you may have seen these facts and figures before, but I'll reiterate for any newcomers as well. They're useful for putting the problem into context. So injuries are actually the leading cause of death among Canadians aged 1 to 44. That's bad news for a lot of us in the room. And actually fourth among all ages pooled. And they actually cost society $27 billion every year. And if I'm not mistaken, that's actually more than our military spending. Transport injuries in particular are the second most common cause of unintentional injury death in Canada, second after falls, and cost us more than $4 billion annually. And again, to put that into perspective, that's roughly Canada's annual global foreign aid contributions. So injuries are very, very costly. And of those, pedestrian injury costs amount to about $458 million annually. And doing the math, that sounds like it's about 10 times the annual budget for Toronto's road safety. So think of how much money that is. And there are over 250,000 pedestrian fatalities globally each year, which is about 22% of the 1.24 million fatalities on the roads, according to the World Health Organization. And in 2013, according to Canadian vital statistics data from Statistics Canada, we saw close to 300 pedestrian fatalities in Canada. Pedestrian safety research, as we know, is extensive, it's evolving, and we see input from a wide variety of disciplines represented in this room here today, including public health and epidemiology, which is my world, psychology, biomechanics, and of course, the insurance corporations, and road traffic and vehicle engineering, just to name a few, and I apologize if I've missed anyone. And more recently, we're seeing more work on the influence of distraction, built environments, and urban change on pedestrian safety. And I just pulled these photos from the internet. They're on the evolution of pedestrian safety innovations over time. And on the left, we see this interesting device called the man catcher, which is some sort of device affixed to the front of the car. And it would actually push the pedestrian that had already been struck, preventing them presumably from being run over completely. Choose your poison. And then I'm sure some of you have seen examples of the mobile phone lanes. This one's in China, and I've actually heard there's one in Washington, D.C., and possibly elsewhere as well. So I just thought that was really interesting. We have come a long way. Okay, so moving on to some statistics, which is the main reason I'm here today. So this graph here shows the motor vehicle traffic age standardized fatality rates in Canada for 10 years between 2004 and 2013, based on vital statistics from, again, Statistics Canada's Vital Stats database. And 2013 is actually the most current year of vital statistics data available. And we can see at the top of the graph, where the little car is, an encouraging and steady decline among motor vehicle occupants during the last 10 years, and also a decline, but less pronounced among pedestrians. And I'll just add that I'd like to consider these preliminary statistics because I still need to do more drilling down into age and sex breakdowns, as well as test statistical significance. I'm still a work in progress. But so far it looks like an encouraging decline among pedestrians as well. This graph here shows the age group breakdown as crude rates for the most current year of data available, 2013, again using the same data set as the trends, but just for the pedestrians themselves. And as we know, seniors are among the most vulnerable road users as pedestrians with reduced mobility, vision, hearing, and reaction time. So this basically just shows how we see as people get older, the risk goes up. And this is per 100,000 population in Canada as the denominator. And I always like to show the injury pyramid. We see the deaths, the fatal injuries at the top of the pyramid, similar to the tip of the iceberg, and the near miss or prevented injuries at the bottom. and the non-fatal injuries at the other levels being captured in various health data sources, as I've mapped on. And that's not to say there aren't other data sources that aren't useful for insurance, for example, insurance data sources, first responders. We also have, of course, police reports. But I just wanted to show some of the health data sources that we tap into at the Public Health Agency of Canada. Now I'm showing this because it's really easy for us to focus on the fatalities for obvious reasons, but it's also very important to remember that for every death, there are many, many more thousands of injuries that lead to not only hospitalization, but permanent disability, which we know can have life-changing impacts on the families and friends and even the communities of those people injured. So for brevity, I'm not going to be presenting hospitalization statistics today, but I will transition into some emergency department data from the Canadian Hospitals Injury Reporting and Prevention Program, just to get a snapshot at what some of the injuries look like in the other contexts. So CHIRP is a sentinel injury and poisoning surveillance system currently operating in 18 hospitals across the country. And just to note, CHIRP statistics are not considered population-based, simply because we are a sample of hospitals across the country, but nonetheless, the information over the last 27 years has been very useful for reporting on certain injury contexts at a level of detail that the traditional health administrative data can't provide. So this is essentially a pie graph of the breakdown of road user class, and I pooled 3 years of data between 2012 and 2014 from CHIRP. And not surprisingly, the majority at 71% of road users who reported injuries to CHIRP during that time were motor vehicle occupants, and followed by pedestrians at 13%, and motorcyclists and cyclists both at less than 10%. I also looked at the age breakdown of pedestrians reporting injuries to CHIRP during the 3-year study period, and found that the distribution shown on the right, so there's two graphs, so the one on the right, which is normalized based on the age distribution of the entire CHIRP database, was similar to the population-based distribution of pedestrian fatalities that I showed earlier, whereby there appeared to be an increased risk to pedestrians leading up to and during teenagehood, and then declining during early adulthood, and again rising towards the senior years. So I thought that was interesting. And the distribution on the left, on the other hand, is simply a percentage-based distribution of the counts of only those motor vehicle traffic injury cases themselves, showing a different, but I would say expected pattern, given that most CHIRP sites are pediatric hospitals, so you would expect to see a higher proportion among the children in the chart. So here I present the distribution of the pedestrians' injuries themselves, and we see a fairly even distribution between the superficial injuries like bruises and abrasions at 25% of the study population, and fractures at 20% of injuries, and soft tissue injuries that don't get into any greater specification than that at 19%. And the way I calculated this was that I looked at 3 nature of injury fields, because up to 3 natures of injury can be reported by each patient, and analyzed the distribution of the injuries themselves. In contrast to the other graphs that I showed with CHIRP data, the unit of analysis was the patient. So I actually also learned that 14% of the injuries in the study population were either minor closed head injuries, concussions, or intracranial. So those are fairly serious injuries. So just to recap, the purpose, again, of this presentation was for me to provide a snapshot of some high-level statistics on the road user injuries and fatalities in Canada, with a focus on pedestrians to help set the context for the other panelists' presentations. And so in terms of the key messages and the story that I'm trying to tell here is that we know that injuries are very, very costly to Canadian society, with each year pedestrian injuries costing us alone $458 million a year, according to Parachute's Cost of Injury in Canada report. And in Canada in 2013, nearly 300 Canadian pedestrians lost their lives on our roads, with seniors being among the most vulnerable road users when you look at the population rates. Now, 300 people in our population may not sound like that many, but as we know, every death counts, every death matters. one is too many, especially when you consider the friends and the family who have lost their loved ones. But the good news is that we're seeing early signs that our fatality rates are declining among pedestrians in the last 10 years, according to the Vital Stats data. But again, I need to do a bit more work on that. So with that, I'll leave you. And thank you for your attention today. And I really look forward to hearing the other panelists' presentations. Thank you.